Good morning everyone, I'm Dave. I have stage 5 kidney failure. Welcome to my kidney journey. Today's topic is Category 4 Dialysis Hemodialysis Part 14 35 Steele Syndrome in AV Access. Dialysis access associated ischemia, commonly called Steele Syndrome, occurs when an arteriovenous AV fistula or AV graft diverts or steals too much blood flow away from the distal extremity, resulting in ischemia in the hand or fingers. Pathophysiology and risk factors. Because veins have a far lower resistance than arterial capillary beds, arterial blood preferentially flows through the low resistance AV access. In severe cases, blood flow distal to the low resistance AV access site can even reverse direction, pulling blood back towards the access site and starving the extremity of oxygen. Access location. Upper arm accesses carry a significantly higher risk, up to 10% compared to risk fistulas, 1 to 2%. Pre-existing vascular disease, peripheral artery disease, diabetic vasculopathy, and severe arterial calcification. Anatomical factors, large diameter inflow arteries or multiple prior access surgeries in the same arm. Clinical symptoms and staging. Symptoms typically worsen during hemodialysis session when blood pressure fluctuates or flow through the dialyzer increases. Clinical severity is commonly categorized using the Mackay staging system. Stage 1, mild. Cool extremity, mild blue pale discoloration and no functional impairment. Stage 2, moderate. Pain during exercise, dialysis, mild muscle weakness, sensory changes. Stage 3, severe, rest pain, severe motor deficit, loss of distal sensation. Stage 4, advanced, tissue loss, ischemia, ulceration, necrosis or gangrene. Diagnosis and management. Diagnosis is confirmed through clinical exams checking radial ulnar pulses, capillary refill and alongside non-invasive vascular testing, pulse oximetry and Doppler ultrasonography. Compares waveform and oxygenation with and without compressing the AV access manually. Digital brachial index. A dBi below 0.6 strongly supports significant distal ischemia. When intervention is required to prevent tissue function without sacrificing the access, here are the 4 most common surgical and interventional treatments. Drill procedure bypasses the arterial segment with a graft while ligating the arterial distal to the fistula to maintain extremity perfusion. Picker and Rudy procedure moves the access inflow to a smaller distal artery to increase peripheral resistance. Banding and Miller procedure, minimally invasive surgical and or endovascular narrowing of the access, anastomosis to restrict overall flow. Ligation procedure, complete closure of the AV access, reserved for stage 4 ischemia and refractory pain. That's the end of today's topic. Thank you for watching. If you like my content, please hit like, follow, share and subscribe. Have a great day and I'll see everyone tomorrow. Goodbye.